My name is Lindsay Strowd, and I'm Assistant Professor of Dermatology at Wake Forest Baptist Health. I see a broad range of dermatologic diseases in my clinics. I have an interest in medical dermatology as well as an interest in connective tissue disease, so I am actually in a multidisciplinary clinic along with rheumatology and pulmonology where we see patients with autoimmune and connective tissue disease. I also have an interest in inpatient dermatology, which is somewhat rare but an upcoming trend amongst academic centers in dermatology, where we have a focus on acute cutaneous reactions such as severe drug reactions. We see a lot of patients on the Hematology and Oncology services treating things like graft-versus-host disease and cutaneous infections. And so that's been a real interest of mine and something that I get a lot of experience with here at Wake Forest. I think one of the things that I enjoy the most about working with patients is hearing their stories. One of my favorite experiences as a resident was actually working at the VA, or the Veterans Affairs Hospital. We had a clinic there once a week, and hearing the stories, especially from the veterans, just learning wisdom from patients, I think is very important. I'm obviously a little bit younger in my career, and I feel like I can gain a lot of experience through talking with patients and hearing what they're going through and what they've been through in the past. And I think it's really the stories of people that makes medicine so fascinating, and that interaction with those patients is something that I get a lot of satisfaction and enjoyment out of. I think as a physician, especially being in a dual physician family and being a mother and a physician, it's very important to have some degree of work-life balance, and it's one of the things that actually I'm interested in mentoring medical students here at Wake Forest, particularly female medical students, both on developing their own career track, but also on how you kind of work through the logistics of raising a family or being part of a family while still maintaining a professional career in medicine. And it's very challenging, but I think it's something that, females can get a lot of career satisfaction working, especially in academics, while still, getting a lot of satisfaction out of being a mother as well. And so I think a lot of the times when I'm not at work, I'm obviously spending time with my family and devoted to my kids. But I think that's something that in medicine, as there's more female physicians entering the work field, is a very important concept that students, I think in particular, can benefit from some mentorship with that.